What is going on, everyone? This is Dr. Josh Funk, and you are listening to the Strength and Knowledge Podcast.
What's up, everybody? This is Dr. Zach Baker of Rehab to Perform and R2P Academy, and you are listening to the Strength and Knowledge Podcast, and we have on with us a guest, Zach Pevnick, who is in an area of PT that I personally have very little experience with. But have had some friends, some colleagues, and some coworkers go down this route and following along with what Zach's been able to carve out in his early career with it is a pretty interesting and pretty intriguing one. So, Zach, I appreciate you taking the time out of your busy day to come on. And if you don't mind, just kind of spend a minute telling the listeners who you are and what you currently have going on.
Awesome. Thank you so much for having me on here. My name is Zach Pevnick. I am a physical therapist and the owner of a home health therapy staffing company out here in Southern California, called California Therapy Services. So that is my primary business. We send physical, occupational, and speech therapists to patients' houses throughout Southern California here. And then I'm now also starting another project because we all like to be busy, called Home Health Leaders, where now I'm helping therapists become successful in home health. So that's a new project I'm beginning.
That's awesome. And Zach, did you always envision yourself going the home health route? Was that kind of an opportunity that presented at a later part of your journey? How did you get into this specific area of the field?
So I, from a young age, and like to give you a little background, my dad is a physical therapist. He's still practicing, in fact. So I grew up in the physical therapy world. He had outpatient offices. He had home health, developmental disability. He had some hospital contracts. So my summers were spent often in his outpatient offices as a technician. Now we call them aides, helping patients with exercises, doing paperwork for them and typing notes and things like that. So from an early age, I always wanted to be in this field, and I always wanted to have my own company. I went to USC. I was in the DPT program there, and they actually have a class. I'm curious if other programs actually have this. Let me know if yours have this, but we actually, the class was to develop your own practice, and you had to take into consideration things like the square footage of the office, the equipment, the layout, with that goal of having a profitable practice. So I think I was the only person in the class that was interested in it. And for me, it was because, like I said, I always wanted to have a practice. So I went into outpatient. I worked at a great clinic, very busy. When we started there were 3 surgeons. By the time I finished, about 3, maybe 3.5 years later, there were already 8 surgeons. It was a great practice. But what I didn't have, the thing that I didn't have was a doctor relationship. This was a POP, so they referred their patients to their own clinic. So I didn't really have a doctor relationship. And if I'm being honest, I didn't have marketing expertise at the time. So to open up my own outpatient practice seemed really daunting and a little bit of a risk without those things kind of in my back pocket. So I saw home health as a way to dip into a new industry that I knew paid well, and the flexibility of schedule was really appealing to me. And by doing that, I'd be able to kind of avoid the problem of the overhead associated with starting an outpatient practice when you have, have to rent space, have to have equipment. So that's kind of what pushed me in the home health direction. I would originally probably was thinking the outpatient many years ago.
No, that's awesome that you guys had that opportunity at your PT school. We had a similar project in our final year, and we had one of the I went to University of Maryland at the Baltimore campus, and they had one of their former graduates who had started a private practice and had been running it, I want to say, for about 15 to 20 years at that point, and had had success with it. He would always come back every year and do a lecture on running your own business, and it was less about like the X's and O's of how to do it, but more just considerations and advantages, disadvantages, almost kind of like painting a picture of, is this something you truly want to pursue or not? And then we did have a project as well where we had to create a business model, and it could be of anything, whether it was, outpatient or however you wanted to frame that up. And again, I think myself and maybe a handful of others were the only ones that were actually interested in doing it. And it's funny, you write everything out as a business plan on paper, and until you actually get into the real world and start trying things out, some of the best laid out ideas never come to fruition. Some of the ones that you had very low expectations for actually take off. And it was a fun practice to do in PT school. I will definitely say you kind of take your lumps and bruises early on in the ownership world and management world. As I kind of tagged along with Josh Funk, our owner here at R2P, and saw some of that from firsthand. But it's exciting, and it is, I applaud you for going out on a limb and getting into it yourself, because it is daunting. It's intimidating. You have to wear a lot of different hats, and you can't just wing it. If you want to be successful, you have to have some sort of game plan in place. And that kind of brings me to my next question for you. What have been some of the biggest learning curves that you've encountered to date? And this can either be with the California Therapy Services or with your more consultant business that you have.
So I would say there's two big learning curves that I've had. And to kind of give you my timeline, and actually I think it matches up very much with your guys' business. I think I started home health in 2013. So I've been doing this about a decade now. And there were two stages that had big learning curves. The first one was when I first started. So when I first left outpatient, I jumped into home health. I started contracting with a bunch of home health agencies. And my assumption was they're going to teach me the rules and regulations of home health. They're going to teach me, the timelines, what I'm supposed to be doing. And it could not be further from the truth. I contracted with a bunch of agencies, and really what they often did was kind of say, come on into the office, we'll teach you our EMR. We'd spend 20 minutes, and then it would kind of be all right, you got that. Go out and see our patients. And home health is a different game. And you probably had similar experience in Maryland, where the DPT programs don't typically teach you much about home health. There's not that many internships in home health. So you really can't learn before you're in it. And so I didn't find that there was a ton of support with the agencies I was contracting with. So I was really lost in the beginning. And to be honest, I did mistakes. I got yelled at. And unfortunately, that's the way I had to learn. And so that was a huge learning curve for me, just learning all the rules and the regulations associated with home health. And if I'm being honest, it's the main driver for why I've made this home health leaders education company, is because as I talk to therapists across the country, mine is not a unique story. Mine is the common story. So I want to help people as they get into home health, learn those rules and regulations so they can be successful from the start. That was the first learning curve. The second one was, as California Therapy Services started to scale, it's hard to do that with culture. It was something we really lacked. And so probably only 2 years ago, I put a lot of time into trying to build culture into our company. And actually, funny enough, I met Josh at a business conference 6 months ago. I don't know if he mentioned this to you.
No, I didn't know that, actually.
But I think we were sitting next to each other or something. We randomly met there. We had lunch, and I was really impressed with him and the way that he was an effective leader, the way that he had culture with your company. And I know that he does a lot of leadership programs and things like that. So I know that's something that's really important at your guys' practice and that you do a really great job at. And I think that's why you've had so much success. It's something that I'm really working hard to do now, since that was part of my learning curve.
No, and going back to the home health and the lack of experience and opportunities. And admittedly, so I'm a 2012 graduate at University of Maryland, and home health was always kind of viewed as the Wild West. It was, few and far between the amount of people that got into it. And like you had mentioned, it was kind of not a whole lot of expectations. And it was a little bit mysterious as to what home health looked like, what was common practice. And I think you had alluded to helping others who are going through similar struggles that you went through early on. And that is kind of the interesting part of, as you progress through your career, when you start off early on, it's almost like this woe is me mentality. Things are so challenging. Things are so hard. And you think that everything is unique to your circumstance. And then you start to reach out to peers. You start to reach out to others who have been in the field. And come to find out, it just comes with the territory. And the people who end up being successful are the ones who are, one, willing to admit that they are struggling, two, are humble enough to actually reach out and get advice from those, and then three, can actually tough it out, implement and execute on these new initiatives that they have. And I think all three of those steps are very challenging. I think it's very tough to admit when you are having a struggle. It's even more challenging to then listen to somebody else provide you feedback on all the things that you probably should be doing that you haven't been doing, and then actually sticking around long enough to try to right the ship, get concrete systems, processes in place. And as you know, in the business side of things, those aren't always an immediate ROI. And it may be something where it takes some time to see those changes actually reflect either on a financial statement or just with how things are going within your business. And it's challenging, but it is one, in my role with our company, having more of a mentorship standpoint with early career navigation and patient care. It's funny because every scenario that I hear a young or just a new clinician to our company express to me, I can think of like 3 or 4 different times at my stages in my career where I had that exact same feeling or that exact same issue. And, you know, it's fun to get to a point in your career where you kind of have that realization. And it's even more fun when you can help navigate that situation with somebody else who's going through it as well.
That was beautifully said. I completely agree with you. And yeah, I just resonate with that so much. And the fact that you guys are doing that mentorship, I mean, it's got a lot of similarities to what I'm trying to do. And you're totally right. We all have to realize we're not that unique, right? And what one of us goes through, many of us go through. And that's why we have the ability to help each other.
Absolutely. Now, Zach, going back to the home health landscape and, you know, what I thought and kind of still think is the Wild West, because I don't know a heck of a lot about it. Can you shed a little bit of light, like what opportunities are out there? So if we have people who are, you know, they're outpatient PTs, they're inpatient PTs currently, or maybe they're still in school and they're looking for different opportunities that they may be less aware of. What does the home health landscape look like? Is it full-time? Is it part-time? Can you do PRN gigs? Can you paint that picture a little bit?
It's everything. So especially as you go throughout different parts of the country, and now like I've got a Facebook group, the Home Health Leaders Facebook group. So I'm connecting with a lot of people throughout the country, and it differs a little bit in territories, but everything exists. Full-time, okay, part-time, PRN, contract. There's some therapists that do work in outpatient or do work in acute, and they just pick up a couple patients on the way home and see them in home health. And then there's people that do, you know, well over 100 visits a month. So it really ranges. Some unique things that happen are like assisted living facilities that has a agency or a partnership of some sort where it's the therapist is mostly staying in that building throughout the day. Those are some unique opportunities that not a lot of people may know about. And they're great opportunities because it cuts the drive time. It's walking from room to room, can be highly profitable. It cuts out that drive time. And so you can be finished earlier. There's some great opportunities out there.
No, that's awesome. And I have a friend of mine that he graduated several years before me from Maryland, but he was dead set outpatient ortho sports med. And then I honestly don't even know how he stumbled into it, but he stumbled into this home health role that he blossomed into an amazing home health company And that's kind of what he alluded to in Montgomery County, which is close to where we live. They have pretty densely populated and pretty affluent communities of senior living facilities. And he would carve out his workday where he would go into a neighborhood and he'd have 5, 6, 7 patients in a row that were literally just walking from like doorstep to doorstep. And he had to commute maybe 20 minutes to the neighborhood. He just knocked out all of his appointments in that neighborhood, knocked out his documentation while he was there, drove home, and it was no different than just commuting to and from the office or to and from the hospital that he was working at. Would you mind, can you shed a little bit of light on why would somebody pursue home health as opposed to a different setting of PT? And I know there's obviously region by region is going to be a little bit different. You can always find an exception to every rule. But when you speak on a macro level, what are some of the benefits that you found personally of transitioning into the home health space?
The two biggest benefits I find in home health are, number one, generally it's one of the highest paying sectors of therapy. So that's certainly appealing. The other big appeal, sometimes I call it like the hidden benefit of home health, is the flexibility of schedule, that ability to, be done at 3. A lot of people are done at 3. Some people are done at 2, or take the 4-day weekend and you don't need to even request days off and things like that. I'm linked up on Instagram with these 2 girls, and I believe they're in DC. And they even have a full-time job, and it lets them just do 4 days a week as long as they hit their productivity. So for people that are looking for a flexibility of schedule, I think it's really, really a great sector to go into. My wife, we just had our baby a little over 3 months ago, and maybe I'm just hypersensitive to it now, but we have like 10 therapists that just finished maternity leave at our company. And like for them, that flexibility has just been massive. So I think those are the 2 big things that pull people into home health.
No, and I can speak from experience. I've had several friends who were in either the inpatient or outpatient setting that they hit a different stage of life. And whether that was, having a child or just getting to a certain point where they wanted something different, they transitioned into home health and they actually worked less hours and were able to replace the previous income that they had left doing less work. And I know oftentimes you think about that, coming off of maternity leave or coming off of paternity leave, but it's always such an interesting transition. And I think sometimes it takes a big life event like that for people to really step back and see, hey, what other opportunities are out there? And with home health, there are a variety of benefits. It is not easy, though. And I think there are this illusion that, I can just switch to home health. I can pick my own hours. I have all this flexibility. I can work when I want. I make a lot of money, which, yes, a lot of that is true. But what would you say, what are things that people need to know if they are considering pursuing a home health job? Or are there certain traits or characteristics that really lend people to be successful in this area?
Totally. So when our recruiter interviews a person, she'll know, she's like, this one's going to be excellent, because those traits are like super apparent right away. So somebody who's can operate by themselves and be internally motivated and then really organized and a go-getter, those are the people that are going to make a ton of money in home health. And part of that is because you are out, of course, in the field by yourself, and you kind of have to take that leadership role. You have to take that responsibility. If a patient needs to reschedule, you have to be effectively able to reschedule them. There's not, in many cases, somebody in the office restaffing them. It's you doing these things. So being effective at those skills becomes incredibly important. That's why, there's modules in my program where I actually train these kind of things, because they make the complete difference from being successful and not being successful. The other thing that I like to talk about a lot for people going into home health is to make sure, unless you have a full-time position that is salaried and pays you the same amount, no matter how many visits you do every week, and of course you need to hit productivity, but I'm getting at you have a consistent salary. Unless you have that situation, I really believe you need to be working with multiple agencies. It's something people don't talk about. But what people do often talk about is that they have trouble keeping a full schedule. They don't have enough patience. And that's often a product of being limited to only working with one agency. So I really am an advocate for people either working for a home health therapy staffing company like ours, for example, that works with, for us, like we work with over 300 agencies. So we do the diversification for our therapists, or they go and contract with multiple agencies so that when one is slow, they have referrals from another. And that's the way they need to keep their schedule full. So I'm really big on advocating that.
And I'm glad that you had mentioned some of the traits as well, because that's what always, the friends of mine who have gone into home health and who have been successful and have also really enjoyed it have been the ones that are extremely organized. They're self-starters. They honestly have a lot of kind of entrepreneurial characteristics, but maybe just without the drive of wanting to fully start their own business. But they like having that ability to control their schedule and be very influential in what their day-to-day, what their week-to-week looks like, how they interact with patients, and being very hands-on in a lot of the behind-the-scenes stuff as well. So I'm glad that you had mentioned that, because that was kind of where my head was with, and just making sure that wasn't isolated to the experiences that I had seen. One question for you before we wrap things up here shortly: if you could change one thing that you've done in the past in your career, what would you change? Or I guess another way to frame this up is like, if you could just give advice to your younger self, what would that be?
Oh, that's a great question. And I'm probably the only person that will ever answer it this way. My advice to myself, at least, and this might not be for everybody, but my advice to myself would have been to be less professional. And what I mean by that is when I was at USC at the DPT program, I didn't really hang out with the other people in the program. And the reason was I didn't want to go to a bar with them and drink with them because I didn't think it was professional. I didn't want to, go down that road and have any risk of not being someone that they considered professional. They'd want to refer patients to, they'd want to work with. So I kind of isolated myself from that. And then when I went and worked in the outpatient office, once again, I did that. I didn't hang out with the rest of the people after work. I didn't go get drinks with them. And it was for that exact same reason. And that was totally, in retrospect, a huge mistake on my part, because having those relationships is the most important thing. That person is the one that wants you to see their family member. That is the one who wants to work with you or send you patients. So, I think we need to watch the line of being overly professional where it starts to harm being a person and having those relationships. I wasn't even on like Instagram, I think until like 6 months ago in this therapy world. And I wish I had been. The people I have networked. Look, I'm getting to talk to you guys right now. How awesome is this? You're one of the best clinics in the country and I'm on this podcast. It's amazing. And I never would have had this relationship before because I wasn't open to it. I was too professional. I didn't want to put myself out there in that aspect. So that would be my biggest advice to myself.
No, that's awesome. And what I really get from that comment is be genuine and authentic. And I think oftentimes we mistake, professionalism or a lack of professionalism or, are we being appropriate or inappropriate? I think oftentimes it just comes down to being yourself. And obviously you have your own core values and beliefs and to go whichever route you want with that. But in the end, we are in a very personable business. And whether that's with us interacting with patients or us from a management standpoint interacting with colleagues, people want to know that, yes, you are qualified and you are competent to do your job, but they also want to know you as a person. I think it's very difficult to get the most out of any relationship if somebody doesn't truly know and trust who they're working with. So I'm glad that I'm glad you said that. You're correct. I've never heard anybody say that before, and I'm glad that you were brave enough to say that on here. Zach, I appreciate you taking the time to come on here. For people who are interested in either just following with along with what you have going on, connecting with you, or learning more about some of the opportunities that you have, what is the best way for individuals to reach out to you?
Yeah, definitely. So I am on Instagram, Zach Pevnick PT. I'm also on Facebook, and I have a free Facebook group called Home Health Leaders. And if you're interested in my Home Health Accelerator program, you can just DM me on Instagram or message me on Facebook, and I'd love to talk about it.
Awesome. Well, Zach, I appreciate the time, and best wishes to you as you progress throughout your career.
Thank you, Zach. Have a great day.
Thank you for listening to the Strength and Knowledge Podcast. If you enjoyed this episode or have been tuned in for multiple episodes, we would love for you to subscribe, rate, and give us a review on Apple Podcast or Spotify. Until next time, thanks for listening.